Hi, my name is Sebastian Neumann. I'm a postdoc at the Hamburg Center for Health Economics and would like today to present to you in a pitch Kucha my experiment on reducing inappropriate emergency care use based on a vignette-based experiment. What we do see in Germany is that when physicians are not available outside of their practice hours, people tend to go to the emergency room as an alternative. It's a large strain on staff, hospitals lose money on it. We do see it's an increasing problem. There are two potential explanations for this, really, or that I see. One is health literacy. People might not know how to operate the healthcare system. It's complicated. They might not know how to navigate it. The other is they might not know what is an emergency and what not, so uncertainty. I used two vignettes in my experiment. One is appendicitis, an urgent case that needs emergency care, and one is just a stomach ache that doesn't need that, both for 15-year-old students, and response had to imagine to be the parents of the student and to decide for it. I had 303 respondents in an online experiment, and in the urgent case, they could seek appropriate care or underutilize, so not go to the ER. In the non-urgent case, they could overutilize, go to the ER, and my intervention was a control center that would inform them of the correct decision. And when you look at health literacy, people who struggled with navigating the healthcare system also were significantly more likely to overutilize. And if you look at the descriptive results, you see in the control condition that there was a usual rate of overutilization, which dropped quite a bit with the intervention. And the second intervention added a societal framing stating that emergency rooms tend to be overcrowded. If I control for several factors using an odds ratio, logistic regression here reporting odds ratios, I do see a 66% reduction or 61% reduction depending on the intervention in the likelihood of overutilization compared to the control. For underutilization, which is medically even more serious because having appendicitis and not going to the ER is serious, it dropped from 9% to 2% in both interventions, which is a very good result. And also here, grouped together, because of the smaller sample of underutilization, we do see a significant effect at a marginal level of significance, which I think is acceptable for this case. I had three hypotheses going into this. One was an information effect, so people are uncertain, and I think I found evidence for that. The other was framing, if you point out that emergency rooms are overcrowded, and the third one was health literacy, and also find evidence for that. So in conclusion, this fits nicely into other findings from the literature, my findings here. And the takeaway for you would be guiding patients can really offset the disadvantages of health literacy, especially in reducing overutilization. Thank you very much.